you're pretty familiar with what has gluten and what doesn't, right?
Yeah.
So we know the gluten-free grains are things like arrowroot is a good substitute or cassava flour. You can use flax meal, obviously all the nut flours like
Mhm.
coconut, almond, hazelnut flour. Oats are supposed to be gluten-free, but I say specify to make sure and buy gluten-free oats because there can be some cross-contamination there. Quinoa is a good one, and rice. Even things like teff is gluten free. So, those are a lot of the nice substitutes. The things that you want to be cautious of, obviously, are barley, any couscous, if you're familiar with that,
Mhm.
most of your, any basic flour. And like I said, even the oats, I like to, I'm very specific with patients and say, make sure you get the gluten free. Spelt, those all have gluten in them.
Gluten.
Why do we want to avoid gluten? We know that celiac is a true allergy. It's an autoimmune response. It causes havoc to the small intestine, creates this intestinal permeability, this inflammation, and then that can cause multiple symptoms and hence malabsorption eventually. The thing is, with intolerance or sensitivity, we can't always pick that up. Sometimes we miss celiac, believe it or not, with some of the testing that we use. And so the best way and really the most affordable is just to do an elimination diet like you have done. And so by just removing gluten for a good 4 to 6 weeks and then slowly reintroducing that in small portions, it gives us an idea of, if we do have a true intolerance, because again, these testings that we do don't always pick that up. And people have the misconception that it always presents from a gastrointestinal standpoint. So constipation, diarrhea, gas bloating, but that's not the case. It can present in so many different ways from acne to joint pain, brain fog, irritability, hair loss. I mean, there's so many different presentations. And so a lot of people struggle though because gluten is in everything, or at least it seems that way. So we've had a lot of new folks come into the Living Vitality program. And so just trying to gently ease them into this gluten-free way. And then once you're there and you know all that's out there and you know some of these alternatives and even some of these different cookbooks and recipes, it's not quite so overwhelming and it just becomes, their natural way. So they don't have to try as hard and it's not overwhelming for them. We've talked about a couple cookbooks in the past, so I'll mention a couple of those. In fact, I think it's Danielle Walker, the cookbook Celebrations is one that I purchased over the holidays.
Yeah.
And that's a great cookbook. She goes through, especially if you host a lot around the holidays, but she goes through all sorts of different recipes specific to each holiday. So fun and festive drinks and appetizers and main courses for Halloween and New Year's and whatever holiday it is. So that's a good one that I definitely recommend. When someone's initially starting out the gluten free, I always say, try to steer clear of like the gluten-free products. So the gluten-free bread, they're the gluten because you can go down, a rabbit hole there and have equally as many issues as you did with just the gluten because sometimes we don't always know what they're replacing the gluten with and it can be equally as harmful. So when someone is first starting out, I say just remove it altogether. So get rid of the pastas, get rid of the breads and the pastries. And then the big question becomes, especially if they haven't been in this space where they've done the elimination diet and they don't know where to begin. I start with breakfast. So we've talked about sweet potato, taking those and slicing those, and you can toast them and put them in the freezer, even if you put them in the oven, and then store them in the freezer sliced. And then you can pull them out and put them in the toaster oven. Put a little bit of butter on them, maybe some avocado. Veggie hash is a nice filling breakfast if you put lots of veggies in the skillet with some maybe organic sausage, depending on if they're dairy insensitive or they have an intolerance there, maybe a little goat cheese on top. Other substitutes, as I mentioned, rice with a nice clean organic protein for a meal. Quinoa is another good option. Potatoes, you could do some red potatoes roasted with some avocado oil and sea salt. Just be cautious with the mashed potatoes because for some reason when they're mashed in that form, it can actually increase the blood sugar even more than if they're chopped. And mashed potatoes in general just aren't the best for blood sugar balance anyway. So I do prefer sweet potatoes with that. Since you've been through this, do you have any tips for our friends who are maybe just starting out, how you kind of transition from, gluten to gluten-free?
Well, I figured the best way to do it is just to go cold turkey, take it completely out.
Yeah.
And because I was gluten free, thought I was gluten free when I started the program, because from this journey that I've been on, the rheumatologist told me I was celiac. So I was really watching it, but not really knowing. And then so I followed this lady. I mean, everything's just like butter and sugar, but she said gluten free. But oh my gosh, she uses white rice flour, tapioca flour. She does this blend, cornstarch, which I don't do cornstarch. What else? All these things that she makes a blend. And so I was making the bread that she had, the
Okay.
white bread, and because I knew what was in it. And then
Yeah.
Dr. McRae told me, no, you don't need to do the rice flour. So the journey has been just get away from it. And then what I know, I have a gluten intolerance. I do not have celiac because she found that in my DNA. One day I just wanted a hamburger to go out to eat. So we went out to this little train up on the hill when you get off of the exit there off of 71. I have no idea, but they have the best hamburgers there.
Yeah, they do. We need a family too.
And the French fries, before I haven't been there in a long time, and I told them I wanted a hamburger. And so we went out there and I cut it in half and I just ate the bottom bun because it's the thinnest.
Yes.
I didn't have any trouble at all, but I couldn't eat their French fries. Normally they're really good, but they were really greasy this time. So I not having the oil hot enough or something. I know they use peanut oil, I think. So I didn't eat many of those.
So you're more aware of what impacts you and affects you in that negative way so that you can avoid it in the future. But sometimes it just takes some time to figure that out. So here's the thing I think we talked about this too, but when it comes to omega-3 versus omega-6, we need some of both. But the problem arises when we're too much omega-6 compared to the omega-3.
Yeah.
And so things like safflower oil, sunflower oil. So we always try to balance that out. Most of us, when I've reviewed the Boston Heart and we do the omega fatty acid balance test, most people are deficient in their omega-3s anyway. So usually we have to bump them up in supplement form anyway. But it's really hard to get that balanced out, where it needs to be.
Especially when you don't eat fish. So yeah, I do.
Yes.
I take ortho omega.
Yeah, that's great. Do you do 1 or 2?
I do 2.
Okay, perfect. Yeah, that's actually my favorite so far. It doesn't leave that fishy aftertaste. It travels well, doesn't have to be refrigerated. So also doesn't leave you with that acid reflux or, some people have that regurgitation after fish.
Yeah.
Yeah. So that's good. I'm glad you're on that.
Yeah.
Well, good. Well, thank you for some of those tips and advice for others. I know, like I said, you've been down this road and you're kind of on to other things, and gluten one of those things that's not a huge concern for you, but we have.
No, you still have to watch and read and it's not easy.
It's not easy, especially when you're going out to eat and you're looking at different dressings. It's just, you really do you almost just have to do your homework and your research and figure out what's in, especially if you have some favorite restaurants. And you know what? More and more people are finding that they do have an intolerance, whether it's to gluten or dairy or eggs or whatever. So I do feel like when you go out to restaurants, they are, it's kind of the norm that you do ask about the ingredients and some of those details. So I just tell patients, don't feel bad. It's your health. So you just have to figure out what makes you feel well.
If I had any advice for somebody that's just starting this journey, is just don't do it. Just don't do gluten. Just stay away from it. It's just not worth the time. I'll be here next week. So
okay, good.
Let's see. Have a great week.
All right, you too. We'll talk to you later.
Thank you. Bye.
Bye.